Hello and welcome to the Full Scottish here on Broadcasting Scotland. My name's Kenny McBride and I'm joined today by two excellent guests. First, I'm joined by Professor Linda Bauld, who's the Bruce and John Usher Chair of Public Health at the Usher Institute in the University of Edinburgh. Linda, how are you this morning?
I'm very well, Kenny. Good morning.
Excellent. And also on the other side of me by Tommy Sheppard, who is the MP for Edinburgh East and the SNP Shadow Leader of the House. So Tommy, how are you today?
I'm good, Kenny. Round to go.
Very great. Right. Well, we start, as we always do, with our coronavirus statistics update. These are figures as of 2 p.m. yesterday. Of course, today's figures will be published in a couple of hours. And as of 2 p.m. yesterday, a total of 99,932 people in Scotland have been tested. Of those, 84,891 were negative, 15,041 tests were positive. There were 841 people in hospital with suspected or confirmed COVID-19 last night, 36 of whom were in intensive care, with another 14 with suspected COVID-19 in intensive care as well. That means that a total of 2,261 patients who have tested positive have sadly died. That's obviously a small increase in the number of deaths, but again, slight reductions in the numbers in hospital, which I would take to be good news. Now, if you do want to join the conversation today, you can do so. You can follow us on Twitter at BroadcastScot, and you can use the hashtag FullScottish, and we'll get your tweets up on screen during the show, as you can see already. We've got a tweet in from our good friend Chris McCusker there to get us started. But we start with one of the biggest stories of the weekend, certainly, in fact, one of the biggest stories of the entire coronavirus outbreak so far. And this is Dominic Cummings, the Prime Minister's Chief of Staff, one of his most trusted lieutenants, chap who ran the Vote Leave campaign. He was found to have travelled to Durham, to his family's home, 260-mile trip with his wife and his young son, because he felt that the parents, his parents, needed to be able to look after his child if he got ill, which he apparently did. Now, this has caused quite a ruckus. Obviously, a lot of people very upset about this, but the government seems to be completely behind him, 100%. And Tommy, I'll come to you first on this. The reaction of the government has been to say that actually what he did was perfectly within the rules, and that actually it was the right thing to do because anybody would want to do their utmost to look after their child. What do you make of the way that the government has responded to this?
Well, I mean, I think it's a fairly typical response from the contemporary right-wing playbook, if you want. I mean, Steve Bannon would be very proud of what their response. It's simply a matter of never apologise, never explain, and that's they hope that they can just try and face it out. And that eventually it will go away. I think the problem for them is that this one really isn't going to go away. There's no question but that Dominic Cummings should have gone already. And I'm pretty confident that he will go at some stage during the week ahead. They're lucky they got a bit of a breather in that Parliament is in recess this week, so it won't be possible to exert the same sort of pressure that we might have been able to do had Parliament actually been meeting, but it's only a matter of time. He's got to go, and I'm not at all impressed by this suggestion that he was only trying to be a good father and do what any father would do. I mean, there are millions, literally millions of people who are having their freedom curtailed at the moment in order to try and deliver on public health and to stop the spread of this contagion. We all know people who have been unable to visit sick relatives, who have been unable to attend funerals of loved ones, who have been couples who have been unable to see each other because they weren't living in the same household at the start of the lockdown. Everyone has had to put up with a lot over the last few months, And it is simply unacceptable for the government to say that the public have to put up with that, but their chief advisor does not. Somehow he is exempt. It's quite shocking. And if they don't get rid of him very quickly, then it will spread. This will spread like a contagion too, a political contagion across the government. And it won't just be Cummings' resignation that we'll be seeking in the days ahead.
Well, we've seen the number 10 obviously put out a statement with full-throated support for him. Rishi Sunak tweeted in support, Michael Gove, Dominic Raab, I think, Matt Hancock. What is it about Dominic Cummings that he's able to exert so much power, it seems, when he is just a political advisor, really?
Well, I don't know what he's got on them. I mean, it's almost as if he's got some leverage that the press and the public aren't able to see. Who knows? I don't know. I mean, I suspect that they're just panicking now, and that they feel that being under so much pressure anyway, and with the government clearly quite strained at having to deal with the pandemic, that it would just be unacceptable for them to lose the kingpin of the political coordination in number 10 at this point. They're already fraying at the edges. If you take this guy out of the picture, then maybe the whole deck of cards might begin to fall. I expect some of them are extremely worried about that. But Rishi Sunak, Raab, and others are doing themselves no favors. I mean, they tarnish their own reputation going forward. And of course, I mean, the big problem about all of this is that it confuses the message. It means that, there will be plenty of people now in the general public who will look at what's happening and say, oh, well, if it's not that important, if it's only, if it's not actually the law, it's only guidance, then it's fine if I break it because I've got an exceptional family situation. And suddenly, when tens of thousands or hundreds of thousands of people start doing that, then suddenly you have a very serious health problem, which is really caused by the government's inaction in dealing with the misbehaviour of one of their senior officials.
Mm-hmm. And Linda, this question of how the waters get muddied, the government had already come under a lot of criticism recently for their change from stay home to stay alert. A lot of people obviously said, well, that doesn't really mean anything. It's not a clear public health message. And, one of the important things about public health messaging is that it is clear and simple and easy for everyone to understand. What do you think this will do to people's understanding of those public health messages?
Well, I think it's very damaging. So what we know from research about how people respond to government messaging is that trust is a key component. So people expect to be able to trust their senior officials, particularly politicians, but also people who are advising government. And of course, we've seen other high-profile cases, haven't we, including in Scotland, where the rules have been broken. So this undermines trust fundamentally. That's the first thing. The second thing is it creates division. So what you see is somebody, in this case, who's very affluent and privileged, who's in a powerful position, and it looks like he's made decisions that the rest of society are not supposed to be taking. And that creates division and exacerbates inequalities. So that causes problems. The other element, as Tommy has already said, is about the power that particular individuals have, and again, sending the message that we're not all equal. So we've seen that scientists are disposable in this. Professor Neil Ferguson had to resign very quickly because of, again, a breach in the rules. So I think the problem is that we're in almost unprecedented times in the extent to which the population is expected to comply with government advice for their own protection. Really severe action. So if the government doesn't follow its own advice, including those close to elected officials, then absolutely, psychologically, the message to the public is that they shouldn't bother. And the other message is to the groups who already don't trust the state, don't trust the kind of apparatus of state, the organizations associated with government. And of course, there are many in society that have been disenfranchised and don't trust officials or institutions for sometimes good reasons. Those will be the groups that in particular will say, well, sod it. the risk is overrated, isn't it? I guess that's the final thing from a research perspective, is that there is a group in the population and in all countries that just think that governments are exaggerating about the risk of the virus. And to see somebody not following the rules who's prominent, I think will also support that. So for Scotland, obviously where we are, the government's been much more consistent and clear in its communication, even though we've had some unfortunate cases here as well. And I think what we need to do in Scotland is try and not get dragged into what I think is a UK level debate, and try and encourage the Scottish population to still stick with it for very good public health and scientific reasons.
Yeah. As you said,
try and encourage the Scottish population.
Neil Ferguson came under a lot of criticism and was obviously required to resign from SAGE as a result of his indiscretions. Now we've heard that Dominic Cummings also sits on the SAGE committee, and yet he's not being asked to resign here. I wonder, what do you make of the idea of this quite Machiavellian political actor being part of a scientific advisory committee?
Well, from my reading of that, is that the status of everybody on that group is not equal. So I think that he is attending, but he hasn't, he's not a member in the same way that some of the others are. So that's my understanding. But unfortunately, I've worked as a government advisor. I was a UK government advisor in my own areas of expertise in public health in the past, and I still chair, a committee for the Scottish Government, etc. So I have some insight into not SAGE at all, but how other groups work. And what you do see is that you do occasionally, depending on the government, have people who are not civil servants, who are special advisors or others who yield huge influence. And this is not just the case in the UK. I've seen it in some of the other countries where I've done some work. And for the scientists, we always kind of wonder, well, what is the status of these people, and what is their advice worth, and also, how do they regard scientific advice? So sometimes it can be quite tricky, and I've also observed that special advisors, even when presented with evidence, which to us is kind of crystal clear, will interpret it in different ways that are largely political, actually, and about personal relationships. So I'm quite uncomfortable with the idea that somebody who is a non-specialist and a political advisor has equal status in their advice. But my experience is that's basically how the system works, not just here, but elsewhere. But it's very messy. And this whole case is just hugely unfortunate, and I think very, very damaging, as I've said.
Mm-hmm. And Tommy, to come back to you, there have been a handful of MPs, Tory MPs, I think 7 so far, who have said that Cummings should resign. Now, one of those was Steve Baker, who was a leader of the ERG, hard Brexiteer, who you would have thought would be more or less on side with Cummings and everything that he's there to do. What do you think the feeling is inside the Tory party? Do you think there will be moves against Cummings, maybe challenges to Johnson's authority, or do you think that that triumph in the election in December is going to buy Johnson and Cummings enough political capital that they can perhaps ride this out?
I don't see them riding it out, Kenny, to be honest. I think this is too big and the stakes are too high for them to be able to do that. I think they'll maybe try throughout the news cycle for the next 24 hours, but I think by the time we get to the start of the working week, I think the hours will be numbered for Dominic Cummings, I would have thought. I mean, yes, I saw Steve Bryan and Roger Gale on the television this morning, and there's quite a few others. I mean, somebody like Cummings has got where he is, because of his undoubted abilities, but he's also, his style and his manner will have upset an awful lot of people along the way. So he probably has as many people inside the Tory party who don't like him and won't hold won't stand up for him as he does who do. So I think it's going to. I mean, that's another reason for moving fairly swiftly. Actually, if they let this fester, then it is going to become a political problem inside the Conservative Party itself. And I would have thought the cabinet would take stock and realise that that's a problem they don't need at this particular point in time. So, what's interesting about this is not the fact. I mean, with Andrea Calderwood in Scotland, instantly she held up her hands and said, "Look, I did wrong and I'm sorry." What's interesting about this is that they're trying to actually face out by saying, "Oh, the man did nothing wrong." It's not as if it's not as if he was caught out breaking the rules and forgive and forget. That's not what they're saying. They're trying to claim that he didn't break the rules in the first place, and that is what is the untenable position, especially now as it appears this was not a single act, but happened more than once and may indeed have happened repeatedly. So in those circumstances, I really think that he's got to go. I mean, and if he doesn't, then there will be great political fallout for this. It will sour the rest of this Tory administration for the next 4 or 5 years.
Mm-hmm. And when you look at the politics, as you say, Catherine Calderwood did hold her hands up and apologise, but subsequently, and the First Minister initially was reluctant to ask for a resignation. Eventually, when it came out that she had travelled more than once and had kind of not been entirely honest about that, First Minister did act. What do you think the politics, how the politics of this will play out in Scotland? I mean, we've seen that Ruth Davidson and Jackson Carlaw, for example, have had almost total radio silence since the story emerged. Do you think the Tories in Scotland will come into will suffer for this, having gone so hard on Catherine Calderwood and then also on Jean Freeman for helping someone with their shopping?
Well, you would hope so. I mean, I think for the integrity of those Conservative politicians in Scotland, I think it's important that they break that radio silence and come out and say that this action is unacceptable. I mean, you're right; they were first out of the traps in terms of condemning Scottish government advisors. It would be manifestly inconsistent and indeed hypocritical if they didn't equally condemn UK government advisors. In fact, the most senior UK government advisor. So let's see what happens during the course of today. But I would have hoped that Jackson Carlaw and others will not sit in the fence too much longer about this.
Mm-hmm. Well, we will obviously keep watching how this story develops over the next few days. But I'd like to move on a wee bit. There was an article in the Sunday Times this morning saying that the dither and delay by the Westminster government, by Boris Johnson specifically, when the pandemic first kind of started hitting Britain, has cost thousands of lives. And coming to you first then, Linda, when you read articles like this, when you hear the way that the government acted, the way that the government kind of didn't want to make decisions, wasn't taking things terribly seriously, wasn't necessarily listening to the best scientific advice, what do you think that says about the way the government approached the crisis? Do you have any confidence that they are making any of the right decisions?
So I think we're still in the middle of this, but there's absolutely no doubt in my mind that now we have the benefit of over 100 days of sort of hindsight, that we know we've done a number of things absolutely wrongly. And of course, those are government decisions. Now, they will have received conflicting advice. I think that's important to be clear. But there's a number of things, just to go in a bit of detail about what my colleagues and I have observed, and also what other colleagues have been advising for some months. The first thing is that in terms of this pandemic and its origins in China, we've seen the other countries that have done much better than we have at containing it, mitigating it, and dealing with it. And they, of course, had the previous experience of previous epidemics, SARS and MERS, for example. And I think our government had this view that it was sort of it was something foreign something happening initially in another part of the world that was very different from us. So there was an arrogance associated with that. And only when it really began to become apparent what was happening in Europe, I think, were the alarm bells ringing. I then think the decision around lockdown was difficult. There were some behavioural science advice or discussion about the fact that you needed to introduce lockdown at the right time because people might not comply indefinitely. There is some truth in that, but I think that's interesting. But I think there were big mistakes made in not putting those measures in place at least slightly earlier than we did. And the big mistakes were the mass events, as we've heard about. I was looking at the data from King's College London yesterday in terms of the C19 app that they're using. And there's absolutely no doubt that that big football match in Liverpool, the Cheltenham Festival, created outbreaks in those areas and then community transmission as a result. So that is pretty serious, actually. And then the other big mistakes that are being made have been around our ability to respond. So we knew what we needed to deal with a respiratory pathogen, a pandemic of this, because we had plans in place and advice about what should be done. So the fundamental pillars of our response, the testing, and then the decision to stop building up the contact tracing infrastructure from March, those were big errors. And you know, in terms of public health, people have been saying that for weeks. So I think there have definitely been avoidable deaths. But a point I'd like to maybe come back to later in the discussion is that a long lockdown has also caused avoidable deaths that are non-COVID related, and also huge social consequences that we are going to be living with and economic for years to come. So we didn't need a lockdown this long, probably, because we weren't ready, and also we hadn't built up some of the infrastructure. Secondly, we probably didn't act soon enough. And thirdly, I just think, you know, there's been so many problems in the whole response that government really needs to bear responsibility for. So I hope that starts the discussion on that.
Mm-hmm. And, you know, I don't, you know, want to ask you to go too far outside your own sphere of expertise and knowledge, but the Westminster government, obviously, there are certain things that where decisions at Westminster affect what's possible in Scotland. For example, it would have been difficult for Scotland to lock down without the ability to provide something like the furlough scheme. How big of an effect do you think that was? And do you think what measures could Scotland maybe have done differently, given the latitude that they do have?
I think in the early days, our government in Scotland was very much trying to do as the other governments were doing, which was adopting a four nations approach. And also, to be perfectly frank, you know, we have expertise in Scotland, but the COVID advisory group, the scientific advisory group, wasn't set up till quite late in this process. So I don't think that necessarily the Scottish government was always had all the advice that they needed early on, or were drawing on it. So they probably maybe didn't recognise, to the extent they might have done, that they could have taken earlier action. To be fair, they did close schools a little bit earlier, banned mass events. There's been some differences around the construction industry, etc. But you're absolutely right. I think that some of the big policy decisions that needed to underpin it, particularly the financial, treasury-based response, it wasn't in our gift, wasn't in Scotland's gift. So what we had is a four nations approach, and of course what we've now seen is a divergence from that four nations approach. And my personal view, and that actually is not just a personal view, it's based on what we know about how you deal with epidemics and pandemics, is that as we move forward, we need to diverge even more. And that is because we need to adopt a local approach to containment. And that's the only way we're going to get through this. So yeah, I think that's part of the explanation. Mm-hmm.
And Tommy, when you've obviously, you were in Westminster when some of these decisions were made. What was your impression of how the government was treating this, and was there a sense amongst the other MPs that things should have been happening sooner, that there wasn't a proper kind of seriousness about the way the UK government was treating the problem?
Well, yes. I mean, there were certainly a number of people in the SNP group, Philippa Whitford for one, who was, you know, calling for action to be taken much quicker than the government did. I mean, we had a situation where even quite late in the day, the Prime Minister was proudly displaying or reporting the fact that he had been to hospital and shook hands with everybody he'd met and had plenty of bodily contact and stuff, and was giving completely the wrong impression about trying to isolate one another. So I think there was some concern, but I have to say that, I mean, in many ways, what I think happened, and probably not just in the UK, but certainly the UK probably more than others, was that we were just watching what was happening in the rest of the world, with still ingrained, I think, at the heart of the government and the civil service, was some view of British exceptionalism, that this was something that was going to happen in the mainland, and couldn't come to the island of Britain. And then when it was apparent that actually it was coming, they began to react much, much more quickly, and in many ways hastily and panically, and made some bad decisions that had to be reviewed afterwards. And the other thing is, in terms of Scotland and our ability to do things differently, I mean, I do think, the Four Nations approach isn't just something you have to do because four governments in the UK have to work together because it's the one administration. It's sort of dictated by the fact that it is, at the end of the day, a single political state, and we do not have independent nations within Britain. And, so people talk, for example, about, well, what if Scotland had went into lockdown earlier and had have closed the airports and stopped people coming in? Could we have done better? Well, maybe we could, but that was never going to be an option because Scotland is not an independent country, does not control its own borders, and does not have the ability to do that. So I think we have to be clear about our capacity to act within the current political setup. And it may well be that when we review how things were done, arguments will come out of the review and the post-mortem which will indicate that we might have been better able to act, certainly had a better capacity to act, were we an independent country and able to act perhaps more swiftly and not have to continually operate within the framework that was being set from London. Now, I don't know if that's the case. I think we could have the capacity. Having the capacity doesn't mean, of course, that it would necessarily have been used. There may still have been things that were done that in retrospect proved to be ineffective or were not right. I think the other thing is I'm struck looking at the two governments, the UK and the Scottish government's response to the economic impact of this, that actually one of the benefits in Scotland is that we have a government that is more capable of being influenced by reality on the ground than the government in Westminster. And I cite as an example to this the fact that with the business support scheme, for example, in Scotland, that when the Scottish government decided that it wasn't going to pay a second grant to businesses with more than one premises, with more than one shop or whatever, as they did in England, there was an outcry about that, and the government changed its mind. It didn't do it in exactly the same way, but it did change its mind. Whereas in the UK, the job retention scheme that the government has brought in to try and keep 7 million people on the payroll rather than being made redundant is absolutely full of gaps and loopholes and people falling through it. And yet, no matter how much MPs across the political divide, no matter how much we make representations saying, look, can you just plug this gap or change that guideline or alter that requirement so that these people, are benefited rather than excluded, we are met with a stony silence. We're met with this sort of line that says, you should be grateful that we moved so quickly to get this in place. Of course, there's going to be some mistakes in it. Shut up and go away. Whereas actually, the fact that they move very quickly is good, but that's not a reason for refusing to acknowledge and change some of the inadequacies in the schemes. And I'm struck by the difference in my ability as someone who represents people on the ground, my ability to get a result from the administration in Edinburgh compared to my ability to get something out of the Chancellor and the Treasury on the schemes they're responsible for. It really is quite different.
Mm-hmm. And on the politics of this, I mean, we talked a wee bit there about the closing of borders. We've seen all 27 EU member states closed their borders during this crisis to a greater or lesser extent. And yet we've not seen this Brexit government close its borders, when that would have been presumably something that would have been cheered up their base in a lot of ways. And at the same time, we've seen Scotland, trying very hard to pursue this four nations strategy, when presumably the First Minister's political base would have been quite pleased to see Scotland do things very differently. What do you think? Why do you think that avoidance of things that would have been politically popular?
Well, I mean, I think because you're limited with what you can do, there's no point saying you want to do something if you don't have the political or legal authority to be able to do it. So because Scotland is not an independent country, it didn't have the option of locking down Scotland by itself and locking it, in effect, locking it down from the rest of the United Kingdom. That's not something that was there for us. So, there's no point sort of regretting the fact that things didn't happen when, we don't have the political organization to be able to make them happen, or the constitutional framework to be able to make them happen. But as I say, one of the aspects of reviewing what happens, because this may well happen, within our lifetimes again. So we need to learn from this experience and prepare. And I think one of the things that may come out of this is an understanding that we might be more agile and effective at dealing with something like this from a government basis, if the Scottish government had the capacity that governments in small independent nations have elsewhere.
Sure.
And just to comment on the travel aspect. So I think it is worth mentioning this for a minute, because I've been astonished. I mean, I'm no expert in terms of travel and public health, but I have been speaking to colleagues from other countries in terms of their approach and their response to COVID-19. In fact, we've set up through the Usher Institute an international webinar series. And it's absolutely crystal clear that the countries that have done better heavily restricted their travel, including their air travel, and they quarantined people who came into the country from March onwards. And you'll see New Zealand and others have done that more recently. Why on earth? I know that air travel's reduced, we heard from Westminster, I think by 99%, and that's fine. But we still had thousands of people coming into the UK from overseas with no real checking, not that the airport checks are terribly accurate, but they do have a role, and no quarantine. And I just completely do not understand that. And I think that it's fine that it's being introduced now. And I know the airline industry is complaining about it, and I have a lot of sympathy for them. But at the end of the day, in terms of infection control and reducing future cases, we do not want imported cases. That's very serious. So it's a crucial part of the response. It should be, anyway.
Mm-hmm. Well, now we've also got to look forward to, Tommy, Westminster reopening. This is due to happen, I think, on the 2nd of June. They've said. Now, obviously, as the shadow leader of the House, you have you have to think about this quite a lot. It's your brief. What's your view of whether Westminster or the House of Commons should be back in action, and if it is going to be, what do you want to see in place first?
Well, I mean, I think the context for this, first of all, is that although the UK government message is now a little bit confused, my best understanding is that they are still encouraging people to work from home if they can do so. So they're accepting that where workplaces can't enable people to work from home, they can get back now in England if there's some measure of social distancing and protection put in place. But they are saying that if you can work from home, you should do so. Now, MPs can work from home. They have been able to work from home for the last 2 months. It's not perfect, but using technology like this, we've been able to express ourselves in debates in the House of Commons. And most critically, the thing which has been developed, which has worked remarkably well, has been the ability to vote remotely and securely using your iPhone or a laptop. So that technology has been perfected. It's in place to allow MPs to work from home. And what the government has now done is it has taken it away. It has said that we're going to remove those facilities so that, in effect, MPs can no longer work from home from June the 2nd, and they have to choose between representing their constituents or putting their constituents' health at risk. And for some reason, the government seems to think it's desirable for 650 MPs to congregate in the House of Commons from all parts of the country with differential rates of infection, to come together to breathe the same air, be in the same space, and then to go back to those different parts of the country. And in effect, you are creating a super incubator for the virus. This is all to be done without any testing or screening or whatever. And it is patently ridiculous. And I think probably what's going to happen on the 2nd of June, unless things change dramatically, is that there will be a demand to reintroduce some aspects of technology to allow people to work remotely. Because, of course, a lot of members of Parliament are in vulnerable groups. Quite a number of them have had shielding letters because of their own medical condition. And these people are effectively being disenfranchised from Westminster. And it matters in Scotland too, because it is clearly going to be much more difficult for people to get there the further away from London they are. And Scottish MPs are the furthest away from London, so we will be especially disadvantaged and discriminated against. So I've been arguing with Jacob Rees-Mogg now repeatedly on this, but they seem to have such a fetish for the green benches and for 19th century tradition that they just cannot comprehend the idea that we might be able to do things using technology. I mean, remote voting in particular is something, or electronic voting is something that we ought to bring in anyway. I mean, when you see how they propose to do this, I think your viewers and the general public will find it ridiculous. It will be something they'll laugh at, because they've accepted that the normal way of voting, where MPs go and crowd into this corridor called a division lobby, they're crammed in there like sardines, and they then file past the clerk, giving their name to the clerk, aye or no, that can't happen, because clearly you can't social distance in that environment. So they're going to try and have a socially distanced physical vote. And this will involve 650 MPs lining up 2 meters apart, snaking all the way around the House of Commons estate and the many kilometres of corridor that they have there, in order to shuffle up and then announce their name to a clerk who will be listening to them remotely and making a tally on a 5-bar gate system. This, we reckon, could take 45 minutes to an hour for all of the MPs to shuffle past a single point and vote in this way, when all you need to do is get your phone, click on the hub, put in your key number, and then vote. And it can be done in a matter of 20 seconds. But, because it's not traditional, there are those who seem to be against it at whatever costs. And I mean, it's ridiculous. I don't plead any special case for MPs, by the way. I know we're probably the least deserving of sympathy when you consider the privations that many people have had to put up with during this emergency. But it's not really about MPs. It's about whether or not we are giving the right message to the public, and whether we are physically actually creating a health hazard. Because I do believe that bringing 650 people or more to London who don't need to be there, keeping them there and sending them back to different parts of the country, is a ridiculous thing to do while we're still trying to stop the spread of the disease.
Mm-hmm. And Linda, on that note, what's your take as a public health person on this idea of people, having to go back into this? I mean, the House of Commons chamber, it can be incredibly crowded on a busy day, and as Tommy says, the lobbies are extremely claustrophobic. What's your feeling about the way that not just Westminster, but the rest of society is going to have to adjust and do things differently? Do you think there will be an appetite for it? Do you think there will be a willingness of people to pursue different ways of doing things in order to maintain a healthier environment?
Oh, absolutely. I mean, with everything from Tommy's thing about voting, I sit on research funding committees. We're virtually meeting now. We can vote virtually. GP surgeries have been trying to switch to more virtual consultations for years, and now the speed has accelerated at pace over the last few weeks because the circumstances have absolutely required it. I'm sure Tommy will appreciate that. We've been quite busy in public health, so I've not been following closely what's the decisions that are being proposed at Westminster, but that sounds to me absolutely insane. So the first thing is, in terms of social distancing, we need to try and look at priority places where there absolutely has to be face-to-face provision. So to give you an example, I teach in a medical school. I don't teach clinical courses, but clearly for medical students, there's absolutely going to be a need for them to have some face-to-face practical training when they come back, probably not in the first semester, but later on. Whereas there are other students where we absolutely will be switching 100% to digital learning, because that is what should be happening. We shouldn't be bringing them into a lecture theatre, even with physical distancing. So that just completely sounds unacceptable to me. The other point in terms of Westminster, the other point, of course, is that I was mentioning about a local response in the future. And we have to recognize that in other countries, we may see outbreaks or a rise in cases in specific locations, including London. So we're going to need to make sure that people are able to stay in their locality if they need to more in future as part of controlling and restricting and containing outbreaks. So I think we all just need to accept that unless absolutely necessary, we shouldn't be travelling between an Edinburgh and a London office. In terms of wider changes, I think that there is going to be a much bigger acceptance that things will work from home. Even within my own family, one family member who was always encouraged to be present in the office, their office has completely had to switch to home working, and they will need to continue that for many months because they now can. So we've seen a big shift, and I think there's pros and cons to that. In terms of social interaction, that'll be reduced, even exercise if people walk to work. But the benefits, I think, for the environment and certainly in addressing the current pandemic until we get a vaccine or effective treatments, we just need to stay apart. And that includes the Houses of Parliament, in my view. Mm-hmm.
Now, we have to move across the Atlantic now and talk about some other interesting political movements. Donald Trump has been saying that he has been taking hydroxychloroquine as a kind of prophylactic against the virus. But we've seen evidence that that drug can actually cause serious problems. It can be very dangerous for some people. And yet he's been evangelical about it. He's been telling people that they should take it, why not take it? And that comes on the top of his ideas about somehow getting bleach into people and somehow getting sunlight inside people's bodies as well. What do you make from a public health perspective of having the most powerful person in the world speaking like this about such a serious pandemic as the one we're facing?
I mean, it's just completely unacceptable. And my colleagues in across different areas of research, have despaired my colleagues in the USA about this president and his public messaging and his non-evidence-based approach. I mean, I think there's a level of humor now about this because even from our First Minister, it just seems insane. And in terms of this malaria drug, there are serious cardiovascular consequences potentially for some groups as a result of using it. So, I mean, I just hope we can almost ignore that in Scotland and just try and, we're in a time where the public are listening to evidence from research, even if we don't always have a definitive answer. We try to be transparent about the areas where there's uncertainty and certainty. And I think the Scottish Government has also tried to communicate uncertainty where it can, so the public appreciate that there is definitive evidence in some cases. But yeah, I mean, I just try to ignore what he's doing. But I think it's a very powerful, important country, clearly, that he's leading. So that type of advice probably just generates more conspiracy theories and misinformation online, not just in the US, but globally. And that's clearly something that should be entirely avoidable.
Mm-hmm. And Tommy, this has kind of become almost another aspect of America's kind of culture war issues, where for Donald Trump this is the Chinese virus. It was also a fake virus. It wasn't real. It was it's a Democrat hoax just trying to ruin his election campaign. And then you've got, it becomes a very much a political issue, where we've seen, some people going out with their guns, trying to threaten politicians to demand their freedoms. What do you think it says about the state of the world, in fact, that Britain and the US, led by these two right-wing populist, seemingly not very intellectually curious men, says about what effect do you think that has on the world, the kind of world stage?
Yeah, well, Kenny, I mean, I've got many criticisms of Boris Johnson, but I probably wouldn't bracket him in the same place as Donald Trump. I mean, I think Trump is in a league of his own in terms of the absurdity and the how dangerous he is in terms of his effect upon world politics and the world population. The best thing to do, I think, as Linda said, in terms of the content of anything that Donald Trump says about how to respond to this disease, is to ignore it, because it's bound to be based not on decent evidence or advice. So he should be, absolutely ignored. But the big problem is that the fact that he is doing this is wasting an awful lot of time and damaging the ability of humanity and the world to react to this and to guard against not just the existing pandemic, but to put mechanisms in place to protect us in the future. I see this as people use war metaphors here, but if this is a battle, then I'd like to hope that humanity is all on the one side against this particular virus or others. And we really need to stress the need for countries to work together through the United Nations, the World Health Organization, and at a regional level to operate together if we're going to have effective coordination to, first of all, tackle and deal with the existing pandemic, and then to put in place systems to prevent this disaster being repeated in the near future. And Donald Trump is just a roadblock to all of that. So one can only hope that given the next opportunity, the American people will see sense and will vote for someone other than such a person to be not just their leader, but to be their front to the rest of the world. Because it's I know many fine Americans who are deeply embarrassed about the behavior of their president, and the sooner he's gone, the better, in my view.
Yeah. And just very quickly as well, we've seen a lot of discussion about world leaders and how different countries are responding to the crisis. And a number of people have pointed out that some of the most successful countries in handling this crisis have been led by women. There's Jacinda Ardern in New Zealand, Katrin Jakobsdottir in Iceland, Angela Merkel in Germany, and a number of others elsewhere. Do you think there is something about having women leaders that is perhaps that does make a difference? Is there something maybe about the levels of trust or the way that women tend to work? Is there anything there that you think we can learn from?
Well, I don't know. I mean, I think it's a good thing that countries are led by women, and it's a good thing that women are involved in the leadership of their countries, because it reflects the population of those countries. So that's well and good. I'm not sure whether the differences in terms of national reactions to how they've dealt with the virus can be attributed solely to the gender of the person in charge. I think there are other factors as well. I think, in particular, the size of the entity that's trying to respond is important. I mean, Germany's done very well, but of course, Germany is a very decentralized country with the individual lender having a lot of responsibility for this and the ability to act in a way that the provincial or local government in most of the UK does not have, and in the way actually more power in the lender to act than the Scottish government would have in dealing with this crisis. So countries where there has been decentralisation of political power, or where there are small countries in the first place, seem to do better than large, highly centralised political states. And of course, the other thing that seems to be very important is the resilience of the society to dealing with this disease is very much dependent upon the degree of inequality that exists. Where you have got a lot of people living on the margins of society and already in a very precarious and vulnerable position economically, and therefore in terms of their health as well, the virus is much more able to have a deleterious effect and works much harder. So countries where there has been a much greater degree of equality tend to be much more resilient in dealing with this. So I think we would have to, you don't draw lessons in the middle of this, but I think all of these things have to be fed into a big review later in the year of how this was dealt with, and we can hopefully learn lessons about how our country can change in order to be better prepared to do this in the future.
Yeah, absolutely. Now, just our final talking point for the day. The First Minister has published the route map to leaving lockdown, to starting to lift some of these lockdown measures. And we're expecting that some of those measures may be lifted this coming week. Now, we have a graphic I think we can bring up just now, which is a wee analysis that we've done here ourselves at Broadcasting Scotland, which shows the relationship between the death rate over a 2-week period versus the number of new infections over the previous 2 weeks. And you can see there, obviously, that steep decline in the number of new cases, but that line at the bottom is the relationship, the index of mortality between the new cases and the number of deaths. So you can see that has fallen. It's kind of come down, and it has been consistently falling for some time now. You can see that there has been a significant difference. So Linda, coming to you first. What do you make of the First Minister's lockdown route map? Is it clear enough? Is it detailed enough? Do you think it has the power to manage this process well?
So I absolutely welcome it. I don't think it's unique. I mean, we've seen roadmaps in other countries, even Northern Ireland has one. We don't have dates on this, but I think it's right to be cautious. So a couple of points. It's very clear from the data, not just your analysis, which I haven't had a chance to look at in detail, is that the peak of infections probably was in early April, actually, from the data we have from King's College and the other surveillance. And then the peak in number of people in hospital was mid-April. And then, of course, you've still got people in ICU, and then mortality follows that. So we definitely are seeing a consistent trend, which basically means that lockdown has worked. However, we've had 10 weeks of lockdown. And as I mentioned at the beginning, it's not a sustainable way to live, not just for the economic consequences, but as I've talked to others about, we've had 200,000 people who've not been screened for cancer. We've got other very serious issues around mental health, around people dying at home, over half reduction in emergency admissions, more deaths at home, many of which will have been avoidable from heart attacks, for example. So this cannot go on. So I think it's absolutely right that we're easing the lockdown gradually. All successful countries have done it in phases. But I think some of the detail clearly needs to be more transparent. And I think it's other sectors, not just the NHS and non-COVID NHS, but sectors of the economy that will desperately need clarity in terms of dates. I mean, we've already heard from, for example, the tourism industry in Scotland saying, well, could you at least give us some indication of when hotels might be able to open, etc. And that's difficult from a scientific perspective to be confident. But I think in a few weeks, once we've seen phase 1, which I think is a reasonable set of changes, we will be able to see within about 2 weeks of easing, actually, from the data, what is happening. And the more we can ramp up the test, trace, isolate, support system, the more real-time data we'll have from localities in Scotland. So you probably know, Kenny, that in Orkney and Shetland, there are basically no cases at the moment in the Western Isles, and there have been very few traditionally. So if we have to have more restrictions in the future, it shouldn't necessarily be happening there. So I think more data with test, trace, isolate, support. Once we've gone through phase 1, we'll be able to see whether we can go into phase 2. And let's face it, at a personal level, including not just for the issues I talked about, but our young people who have not had any education and our young people who are worrying about employment, they need some indication and some hope as we move forward. So if we can get test, trace, isolate, support to work, for me, that's our ticket out of this, actually, certainly until the autumn. And then we'll be able to follow the other stages the First Minister has set out.
Mm-hmm. And Tommy, just to come to you quite quickly, what do you make of the route map, and how confident are you that it's going to work, that these changes will be kind of understood and accepted by the public?
Well, I mean, I think first of all, the Scottish government are to be commended for treating people here like grown-ups and actually trying to be as open with them as they can about the situation. And it's absolutely correct to have a phased approach. And I think the key message is that you can't go to phase 2 until phase 1 works, and so on as you go through the individual phases. So, but if they do work, then we can go through them even more quickly. So that's why I think rather than people sort of jump the gun and try and behave this week as if they were in the following week, people should try and work together and follow the advice as a population, as a country, as Scotland. And I think there is every hope that we'll be able to get through this. I think when we get to the summer, there are some big problems that are going to open up in this, because clearly there are sectors of the economy that are going to be way at the end of phase 4. I mean, the very essence of the hospitality industry, for example, is to bring people together and achieve social contact. You cannot have a city centre pub with everybody being 2 meters apart. So if we're to get to a situation where pubs, restaurants, clubs are to open again, they'll probably be at the very end of the process. And until then, what are we going to do with them? Can we retain the job retention scheme? Can we retain business support to keep these companies mothballed? And if so, are we going to get the resources back from the Exchequer in Westminster to be able to do that in Scotland, where arguably these sectors of the economy are more critical than they are in the UK as a whole? So I think a lot of these, I mean, at the minute, we've got 7 million people locked down and their wages are, well, at least 80% of their wages are being paid. That situation is not sustainable indefinitely. And when that begins to end, I think that's the point at which we see an awful lot of new problems coming forward. So we need to build that into the plan, into the route map as well.
Yeah, absolutely. Well, I mean, we could talk about all of these subjects for a lot longer, but unfortunately we are just about out of time. So I would like to thank both of our guests, Tommy Sheppard MP and Professor Linda Bauld, very much for joining us. I think it's been an excellent discussion. And we'd like to thank you at home for joining us as well, and especially our Muslim friends, anyone who is watching. Eid Mubarak to all of you. We hope you have a really good day and you get to eat well as you celebrate the end of Ramadan. For those of you who would like to support Broadcasting Scotland, we do urge you, if you can, please do go to broadcastingscotland.scot/register and sign up as a supporter there. Your £5 a month can make a huge difference to what we're able to do here at Broadcasting Scotland. Every penny goes towards, first of all, just keeping the lights on, keeping up our internet connection, but then also to developing more new shows, improving our equipment, and all the things that we want to be able to do, all the kinds of new, different programs we want to be able to produce for you. Once we're able to get out of the studio and do a little bit more, we would love to be able to do that, but we can't do it without your financial support. If you're not able to, though, obviously we have talked about it today, that some people are really struggling financially just now. So if you feel that you can't support us financially, then you can still do a great job for us by spreading the word about the show. You can follow us at Broadcast Scot on Twitter. You can search Broadcasting Scotland on Facebook and find us that way, and then share the shows around. Let people know why you watch Broadcasting Scotland. That can be a huge difference maker to us in terms of building a bigger audience and letting people know just what Broadcasting Scotland does. And also as well, there's always work to be done here. So if you're interested in volunteering, getting involved here as either a journalist to prepare these shows, working behind the camera on the technical side, or working in front of the camera like me, like Gordon and various others who have taken this hot seat over the years, then there's always roles here. So do please get in touch with us. Let us know what you're interested in doing, whether you have skills already that you want to exercise, or whether you want to learn something new. There's always something here that we can help with on that front, and you can help us. So do please get in touch. But that is all we've got time for today. So I'd just like to thank once again Professor Linda Bauld from the University of Edinburgh and Tommy Sheppard MP. They've both been excellent guests. I'll be back again on Tuesday with Scotland at 7 as usual. Gordon will be back at 7 tomorrow. And until then, I've been Kenny McBride. Have a wonderful day.